Genetic counseling. To find my resources of information about genetic counseling, I Googled what is genetic counseling, genetic counselor education, and genetic counseling services. My sources of information come from Boston University, the Centers for Disease Control and Prevention, a peer-reviewed article about service delivery models of genetic counseling, and the National Society of Genetic Counselors. I'll review these 4 sources on the next few slides. Before I talk about each of the resources and what they provided for information, just a general overview of what genetic counselors do. They interpret family and medical histories to see about chances of disease occurrence or reoccurrence, inheritance testing, prevention, resources, and research. Some of the specific areas that they look into are reproductive genetics, infertility genetics, pediatric, newborn screening follow-up, cancer genetic, neurogenetics, and cardiovascular genetics. Boston University has one genetic counseling program. There are over 30 genetic counseling programs in the United States and Canada currently. Their website has information about admissions requirements, a quick overview about what genetic counselors do. They list info on acceptance rates, considerations about attending, who gets accepted. They list a quote on their website that in 2010, the 32 programs between both countries received 2,712 applications. And out of all those applications, 731 of them were from individuals, so people applied to multiple programs. And out of all those applications, 230 applicants were accepted, which is about 31.5%, which I found interesting. They also list some tips about how to improve their chances of acceptance, such as reading genetic counseling interview literature, applying a second time, and asking the program directors for feedback about how to strengthen their application, and they highly recommend applying to 4 or more programs. The Centers for Disease Control and Prevention provided information about genetic counseling. They also listed reasons for genetic counseling. One listed that I did not find other resources were genetic screening for diseases that are more common in certain ethnic groups, such as sickle cell disease in African Americans. They also discussed family history, difficulties with pregnancy, trouble getting pregnant, different conditions. They talk about 2 different kinds of genetic counselors. One is a clinical geneticist, which is a medical doctor that provides and performs exams, whereas genetic counselors provide counseling and support and focus more on that aspect of it. They talk about what they do, gathering medical history, talking about these conditions, explaining chances of a genetic condition occurring, discussing treatment options, helping people deal with feelings about how their genetic conditions affect their family, answering questions, and refer people to other resources for help. They also listed information about how to find a genetics professional, asking healthcare providers, the nearest medical school, or conducting a web search. This study was conducted by interviewing 20 genetic counselors in the United States. This task force looked at how these genetic counselors deliver their services, how they worked with patients to see what worked and what didn't. Currently, the only information before this study was the only information provided was from Great Britain and Wales. They looked at service delivery models by seeing how they met with clients and how they delivered their services. They found these counselors use telephone counseling, group counseling, and telemedicine. These added convenience to both the counselors and the patient. What they found was it reduced travel distance, reduced wait times for referrals, and enhanced access to their patients. The travel, it helped because most of these counselors are found in urban areas, but a lot of the patients were in rural areas, so traveling, in one instance, a person was traveling over 200 miles to meet with these counselors. Some of the barriers they found was setting up equipment at the other hospital in the rural areas, getting those kinks straightened out, arranging for testing by having another staff on the other end to coordinate blood draws and paperwork, billing issues. There was questions with how to bill where they weren't technically meeting face to face, and the counselors identified difficulty with being unable to see the patients. They weren't able to see their body cues and assess their body language. What the study found was that the benefits of providing these telephone communications and reducing travel and wait times and providing more access outweighed the barriers of the equipment setup, arranging testing, and being unable to see the body language. The National Society of Genetic Counselors provides information on what is genetic counseling, some information about what they do. They explain it a little further about what they do, including cardiovascular genetics, familial cancer risk counseling, metabolic genetics, pediatric counseling, personalized medication, psychiatric disorders. They, having experience in genetics, open doors and careers to research, public health, healthcare consulting, policy development, and advocacy. They list sources for finding a genetic counselor and other healthcare providers, and they have blog posts about genetic counselors where they can learn about techniques other counselors are using. So basically, genetic counselors look at DNA to see about the probability of occurrence and reoccurrence in genetic disorders such as cancer, infertility issues, prenatal screenings, things like that. The study found that telecommunication for clients and patients in rural areas were effective despite the limitations. There is some education requirements in regards to needing a master's level degree. A lot of experience working with genetic counselors is recommended, and overall genetic counseling seems effective in helping people be more aware of what they may be at risk for or reoccurrence for.